What's that?
That's heroin.
That's heroin? Ready to inject?
Aye.
Where will you be injecting that?
Side car park.
Beside a car park? How common is this to see this in the streets of Glasgow now?
Very common. Very common.
Is it hard to find?
No.
Jane is 29. She's been a heroin addict for 2 years now, injecting on the streets of Glasgow.
See, to be honest, I started taking the heroin because I thought it was my easy way out because I couldn't cope with life. So I thought if I took that I would die, that would be my easy way out. But I don't want to die now, but I've ended up with this habit.
There is now an HIV outbreak in Glasgow, and it's spreading among drug users faster here than anywhere in the UK. Jane tells me she comes to places like this to inject. It's in this city's dark alleyways that users share needles and diseases.
You can catch like AIDS, Hep, the virus, anything like that. Like I caught Hep C using heroin.
You got hepatitis C?
Using the heroin. Because
Do you know anyone that's got AIDS or HIV?
There's a few girls and boys.
It's proving difficult for Glasgow to control the spread of these diseases when the addicts are hidden away in these conditions. Recently, Jane wakened from a heroin fix to find a rat chewing her arm.
I was bit by a rat.
You were bit by a rat?
Next morning I
In the
woke
streets of
up.
Glasgow?
There were 2 dots, yes, 2 dots. Blood run down my arm.
Glasgow first detected an HIV spike 3 years ago. Further research shows it is getting worse, and it's now considered the worst outbreak in the UK for 30 years.
That spike has continued and become very high numbers in 2016 and 17 as well, unprecedented high numbers of new HIV cases. Why that is, it seems to be in Glasgow city centre. There's quite a high number of people who are using drugs in a very high risk way.
Glasgow's council and NHS now want to open a drug consumption room, a clinic where addicts could bring their own drugs to inject with clean needles, under supervision and with the offer of health checks.
We're calling for accessible services for people who are some of the most vulnerable and marginalised in society. It's a terrible situation that we have where we have around 400 to 500 people injecting in public places in the city centre here in Glasgow in some of the most unhygienic, disgraceful conditions.
In contrast to the Glasgow alleyways, this is a drug consumption room. These clinics are already used in Canada, Australia and across Europe. This one in Denmark opened 5 years ago after a surge in drug deaths. Heroin addicts on this side of the North Sea are given a clean room, nurses are on standby and the needles are disposed of afterwards. This is certainly a long way from lying in the gutter among the rats.
And in here there is cocaine and heroin, and in Danish it's called a ball.
Addicts have to register at the clinic, then they're allowed to bring their own drugs here without facing arrest. It's safer than injecting on the streets, and they also get help for any physical or mental health problems, as well as HIV tests.
So now I find the vein, I want to shoot them, but maybe it's gonna work and maybe it's not.
In the time since these clinics opened, Denmark's HIV rates have plummeted to one of the lowest in the world.
Sharing of needles is not an issue in Denmark. It's not an issue in Copenhagen. We don't see it.
That's got to be a big way to tackle disease. What about reducing deaths by overdose?
Yeah, but we have had 700 overdose cases down there, and no one has died.
Not a single person?
Not a single person.
That's a big way to be saving people from dying.
But there's no doubt about drug consumption rooms are saving lives.
700 overdoses treated and no deaths. Another stark contrast with Scotland, which still has the worst record for drug deaths in Europe.
This is my daughter Michelle. She was 16 years old when she died. She was our world. She had so many qualities. There was a lot of beauty in her.
Michelle's mother has joined a support group in Glasgow for families who've lost loved ones. Their remembrance quilt covers the whole room.
This is Robert. Robert died with his first drug injection.
His first?
Yeah, and sadly his younger brother died too.
Every patch here is another drug death, and another reason she believes current drug policies are failing.
I just feel we're not getting it right. There's 867 deaths last year. It's getting worse. There's more people dying year on year. You know, we dread when the drug-related death figures come into fast space, we dread it. Because we know the pain that families go through.
The families in this support group made a video. Pictures of their loved ones. They want to keep the memories alive and remind the world there was a person behind every statistic in Scotland's drug deaths. Drug consumption rooms now have the support of the Scottish Government, but drug laws are the domain of the UK Government, and the Home Office has so far refused permission, meaning that addicts at any clinic could be arrested for possession and staff arrested for assisting drug use. But while politicians debate drug policy, heroin addicts like Jane will be injecting tonight again. And it's the city's alleyways that will be her drug consumption room.